which in turn ripples down into TRICARE.
So this bill will do that.
This bill will delay, right now, there's a mandated requirement to reduce payment to physicians by 21% unless somebody does something about it. It was supposed to have gone into effect on the 1st of January. They delayed it till March, then they delayed it till May, then they delayed it till June. Now this bill has delayed it till November.
And what was the reason why they mandated this reduction in payments to physicians?
It's an annual event.
It's an annual formula that has been in existence for the last, I believe, 7 years. And every year they keep delaying. They postpone implementing it.
I can tell you this right now, I'm not going to do anything to reduce payments to TRICARE. I mean, I can't, whatever bill it's attached to, I cannot in good conscience. People made a commitment to servicemen and women. My own personal opinion is that, and I've said this on numerous occasions, you've got the health care that they have in Congress. I personally think that they should have TRICARE. If it's good enough for our soldiers, sailors, airmen, and Marines, it should be good enough for the men and women in Congress as well. And I think that they might pay a little bit more attention to how that TRICARE ultimately works out and the kind of care that they get if they would actually have the same system.
Yeah, you know, there's probably a whole lot of us that say doctors get paid more than they ought to and so on and so forth. The fact remains, if you start reducing payments to doctors under Medicare, they're going to stop taking TRICARE patients. That includes active duty or recently retired people who are not on Medicare, right? They start reducing that, and I just hope that we can depend on you to make sure that we don't see a reduction in payment.
Absolutely. Well, and let me get, because you brought up a whole other topic. And the topic is, one of the biggest issues, we talked about the fact that Medicare is going to go broke. We all know that's going to happen. The whole point of this healthcare bill was to revamp our healthcare system, and they said they were going to reduce costs. They said part of the cornerstone of their answer for all these issues was to reduce costs. And yet there's nothing really that's cost saving in the entire measure. And we know that if they just tell doctors, we're going to reduce how much you get, they're just going to do just what you said. But no one has ever really figured out what the real root of the problem is. Right now, Medicare gives out a payment to a doctor based on a procedure that they do. And there's really no rhyme or reason whether that procedure is going to be more expensive than that or less expensive than that. And the problem is that they encourage people to see the doctor again and again and again because he gets paid every single time that someone sees him. There's no incentive for him to actually, and I'm not saying that they don't cure people, they do cure people, but the way it works is that they're not incentivizing the doctor to fix the problem as much as to do the procedure. And I had a doctor talk to me and he said, you know what, this is what I wish they would do. If I have a diabetes patient, I've got a range of diabetes patients. Some are better than others. Maybe we'll put them on a scale of 1 to 10. 1 being that they are in the worst possible shape imaginable. They don't take care of their health. They have very bad health to start with, all the way up to the person who's actually doing okay, even though they have the disease. He said if this number 1 is going to cost the government $40,000, the other one can be maintained at a fairly low cost. And yet, if I move someone from that number 1 to say a number 3, there's no incentive for me to do that, really. I mean, I want to make them better, I want to do that. But there's no incentive for moving them from 1 to 3. And if I save the government money by doing that, shouldn't I get a piece of that savings? Wouldn't that be an incentive for me to try to actually get people healthier rather than just do the procedure?
How about the Hippocratic Oath?
Well, first do no harm. But I mean, that is a free market. What's that?
The Hippocratic Oath is not federally funded.
Well, I guess what I'm saying is that we're not incentivizing our healthcare system to use free market principles in order to save money. That would actually reduce costs. Now, you've got the person on the other side that's getting that healthcare. If they're incentivized to actually get better, and we see that people are doing that in places like Hawaii and elsewhere, where they're actually told by their employer, look, if you get in a wellness program, if you lose weight, you do these different things, you're going to get a bonus or you're going to get a break. because the health insurance company gives that company a break as well. They found that that reduced costs dramatically for health insurance. People understand free market principles, and they abide by them. Why don't we do that more in our government? And I think that a lot of the problems that we face with these healthcare bills is that we're not using those principles. And we cannot, but at the same time, we cannot say, this is what we promised you, and we're not going to deliver that promise after years and years and years of you paying into it. And the military has definitely paid into it. Yes, sir.
One comment and one question.
Yes.
You mentioned Gabrielle Givers' town hall meeting things. Somehow or other, they must have pulled my phone number out of the book because they didn't pull it by name, I'm sure. But at any rate, I was invited to be on a town hall telephone thing with Givers. It was an hour long. There were only 4 questions allowed. And she took so long in one of the questions, talked for over 20 minutes, that her so-called panel of experts actually fell asleep. And when she said, now, John or Joe, whatever his name was, what are your comments on it? He said, huh? What? It was ridiculous.
This is some good feedback for the campus.
Yeah. But my question, I have a question, totally different. Where do you stand on the Rosemont copper mine?
I don't support anything that's going to affect water rights for people in Sonoyta, Patagonia, or Green Valley. And if they can prove to me that that's not going to happen, that's one thing. But right now, I've got ranchers that are telling me that they're afraid that their wells are going to run dry. And I cannot support something if I know that they've been there for generations, they've been there all this time, they should be guaranteed the water that they were promised. And I have not heard yet from anybody at the mine or anybody else that can tell me that I can believe that that's actually going to happen. And that's a big concern for me.
Can you just tell us what that is?
What they want to do is they want to put a mine in the Santa Rita Mountains, next to Green Valley. So it's kind of placed between Green Valley and Sonoyta and Patagonia. And so you got the mine has said what they're planning on doing is they're planning on running a pipeline, a cap water pipeline, because their mines use a lot of water. They'll run a cap water pipeline to the community, and that will be their water supply while they take the groundwater. And so here's the concern. Green Valley is a growing community, and they're worried about a couple things. One, about the quality of water they're getting, because cap water is not the same as groundwater, first of all. And the second concern that they have is, our good friends in California they're senior partners on the Colorado River right now. We're a junior partner. There's more of them than there is of us. And the problem is that if they ever assert their senior status over our cap water, what happens to Green Valley? You see what I'm saying?
Let the mine use cap water.
Well, I mean, that's the gist of my problem. And then on the other side, you've got the ranchers and folks on the Sonoyta side, and they've got 2 problems. One, they're convinced, these are the ranchers. We're not talking about wide-eyed Sierra Club, Center for Biological Diversity, left-wing radicals. We're talking about family ranchers that have been there for generations. And every single one of them has said that they're convinced that their wells are going to go down. And they want to know, what are you going to do if that happens to us? And I cannot, in good conscience, I've represented this area, both Sonoyta and Green Valley in the legislature. And I'll tell you this, I believe in free enterprise, but I also believe in property rights. And your property rights are sacrosanct in this country, and I believe water rights are connected to your property rights. If you don't have water, your property is worthless. And I can't do anything that I know is going to hurt their property rights or their water rights. They have to do some pretty good convincing. I haven't seen it thus far. Now, I support mining. I think it's great. I think that we have to be competitive with the rest of the world. But you also have to be willing to not affect the rights of the people that surround you.
Have you taken the tour?
I will take the tour.
I wish you would.
I will. I will absolutely do.
Mr. Payne?
Yes.
I'm surprised my wife didn't bring this up, but I will do it in her favor because it's one of her personal favorites. Since we're the younger demographic here in the room, I'll definitely speak up for them now. We have a pervasive opinion of the city officials or state officials